Good evening. My name is Mandy Robling. I am the manager for diagnostic imaging here at Southern Pacific. And tonight I'm going to talk to you a little bit about breast health. And when everybody thinks of breast health, we automatically go to mammogram. I'm going to talk about what's beyond the mammogram that you can do to help screen for breast cancer. All right. So tonight we're going to start with understanding symptoms, screening, and knowing what your normal is. You're going to hear me say that a lot, know what your normal is. I can't stress it enough how important it is for you to do your self-breast exams, but we're going to get into that a little bit later here. So why is breast health awareness so important? Well, breast cancer is one of the most common cancers affecting women. About 1 in 8 will develop breast cancer in their lifetime. Early detection dramatically improves survival. Many breast cancers are first noticed by patients themselves. Awareness and early action can save lives. What is breast self-awareness? We know what breast cancer awareness is, but what is breast self-awareness? So we want to encourage women to know how their breasts normally look and feel. We want to be aware of changes over time, what looks different, what has changed on the skin, what feels different, and we want you to report any new or unusual findings. And I will again say this multiple times throughout this presentation, that it doesn't matter how minute or small you think the change is, you should always get it looked at. So possible warning signs for breast cancer include new lump or thickenings, skin changes, swelling, and nipple discharge. Mammograms will always be the gold standard as a screening tool for early breast cancer detection. The benefits for mammograms: detects cancer years before it can be felt. Often these cancers that are being found now are millimeters big, 2 to 3 millimeters. And if you think of that on a scale, on a ruler, that's very tiny. It can identify very small abnormalities. Early detection often means less aggressive treatment. This is why mammogram saves lives. General guidelines for mammogram do vary per provider. We always suggest that you have the conversation with your provider to find out what's best for you and at what age you're at. We will always recommend in the radiology world that at age 40 and older, you get annual screening mammograms. Earlier screening can be done if you have a family history of breast cancer or personal high risk for breast cancer. Always talk to your provider about your personal risk factors and decide what time or at what age you should start doing your mammograms. Mammograms are only a small part in the detection of breast cancer. Often, my background is in breast imaging. I did ultrasound, and oftentimes I would get a lot of patients that would come in for their mammogram with an ultrasound because they felt something. So there are multiple modalities that can look at breast cancer. Each of them have their own unique set of skills that are beneficial, but they all work together in a cohesive way to diagnose breast cancer. Early detection includes knowing your breast baseline, and that's why we suggest you get it at the age of 40, so that is your baseline. Your first screening mammogram will set the tone for the rest of your mammograms. Recognize warning signs. That's when your self-breast exams come in, which is the diagram that's over to the right of the screen for you. Clinical breast exams. Again, having your annual checkups with your physicians. If you don't feel like you are doing a good enough job with your self-breast exam, always ask your provider to please check it over. Oftentimes, they will just automatically include that into your visit. If there are symptoms or the provider is concerned about something, they will order diagnostic imaging outside of your screening mammogram. And always follow up the care that's recommended. Oftentimes, this is very often a lot, and I'm sure some of you know, when you have your screening mammogram, they'll call you back for additional views. And that's called a diagnostic mammogram, which we do not do at Summit at the moment. but they will send you to a breast specialist. You will have additional mammography views, and if needed, you'll have a breast ultrasound. And oftentimes, if it's nothing or something they can't see, or they say, well, it was just a change in your previous mammograms, then we'll recommend you come in 6 months to a year. Always follow the recommendation. Very important that you follow those. What do you do if you notice a change on your own? If you're in the shower, you're just laying in bed, or your partner feels something and they say, that's just different. Don't panic. That's the first thing I'd like to say, even though it's human nature to panic. Schedule a clinical exam with your provider. Diagnostic imaging may be ordered. In most cases, they are. Again, follow recommended follow-up care. Regardless of what you're told, just follow it up. If it changes, you feel like it's changing, I will stress it again, always call your provider and ask to be evaluated. Most breast changes are not cancer. And when I heard that line at a conference, I shook my head a little bit to the side, and I was like, okay, can we say that? And a breast specialist said, absolutely. Most breast changes in women are not cancer, but they should always be evaluated. You see a new mole, or you see your skin looks a little different on one side, it's just dry skin. No, always get it checked. Regardless, if it's nothing, great. You paid your copay, you can go home. So I'm excited to say that Summit Pacific, I am bringing the campaign Know Your Lemons to Summit Pacific. I just became an ambassador for them and an educator. And we're hoping to use this campaign as a way to improve breast health awareness in Grace Harbor County. It is one of the counties with the highest number of breast cancer in it in Washington State. This initiative increases awareness of breast cancer symptoms and empower women to recognize early warning signs and in a unique way. And that's why I chose this campaign specifically. They encourage timely medical evaluation and support community education and prevention, which is, there's a lot of campaigns out there and they're mostly fundraising. This is different, this is educational, and it's all over the world. It's not just here in the United States. The unique way that they use it is they use lemons as a way for you to understand signs and symptoms of breast cancer. And you'll hear me say probably more often this year, know your lemons. So symptoms can include hard lumps, thickened skin tissues, skin dimpling, redness, new nipple inversion, your nipple is starting to go in as opposed to out, growing vein. That is a big one that a lot of people get confused about. Yes, that as we age, our skin gets thinner, we can see our veins. These are very distinct veins that are popping out and growing along the breast. Rash or crusting, indentations in the breast, your breasts are swelling, orange peel skin, and change in breast shape. And if you notice on the lemons, they give you an example of every one of these. And I'm hoping by the end of the year, we're going to get models like these so we can have them in our providers' offices and at least posters so they can see them, what we consider as a symptom. But again, if you feel like any change to your breast is different than what your normal is, always get it checked out. I'd rather you come to us and it be nothing than you ignore it and it be something. So I want to talk about some myth versus facts, because around breast health and breast imaging specifically, there are many myths out there that deter women from coming in to getting their screening. Myth one, if I don't feel a lump, I don't have breast cancer. Not true. My years in breast imaging, there are things that you can't see on ultrasound that you see on mammogram. I'm talking about little tiny millimeter calcifications. And those calcifications can indicate a very serious cancer, but they don't often present as a lump. You can go in for your screening and they want to do more imaging, additional imaging, to look at those calcifications. And if needed, they will do a biopsy. So the fact is, many breast cancers are found on imaging before a lump can even be felt. And that's very important to note that these mammogram machines now are 3D. If you go to a facility that does not have a 3D mammogram, I don't suggest that you have your screening there. Ask if it's 3D. For the most part, most facilities have the 3D now. Myth number 2, breast cancer only affects older women. Not true. I've seen it in adolescents, I've seen it in young women, I've seen it in young men, I've seen it in older men. It doesn't discriminate. It does not discriminate at all. The fact is, risk increases with your age, but breast cancer can occur at any age. It does not discriminate. Myth number 3, if breast cancer doesn't run in my family, I'm not at risk. Incorrect. And I understand why people would think that, oh, my sister had breast cancer, so I probably would get breast cancer. However, 70 to 80% of breast cancers occur in women with no family history. And that's pretty significant. That's a high percentage if you think about it. 70 to 80% of women, no family history. That alone should be enough for a majority of all the population to come in and get their mammograms. All right, myth number 4, mammograms cause cancer because of radiation. This happens to be my favorite myth of all times because I've gotten into many discussions about this, and the reality is, yes, mammograms use radiation, but they use a very, very low dose of radiation, and the benefit of early detection far outweighs the risk. This is why education is so important, and it's why I love the Know Your Lemons campaign, because they really try to debunk the providers or whoever is out there who says that mammograms are terrible, you don't do it, it's going to expose you to radiation. And I've seen the after effects of people not doing it because they were scared of the radiation. And it doesn't serve them. So the risk of that low dose radiation is insignificant to having breast cancer. All right, last myth. Breast cancer always causes pain. Negative. No, most breast cancers are painless in early stages. You could feel a quarter size and say, wow, that lump sure does, it feels hard, but you don't feel pain. So I want people to keep that in mind. If you feel a new lump and you're like, oh, it's probably nothing, it's probably just swollen, it doesn't hurt, go ahead and get it checked. Can't stress that. So this is a really quick presentation, but key things to take away. I really love this image on the screen. I feel like it pretty much sums it all up for us. Take the time to check. Screening saves your lives, no matter what screening it is, mammogram and beyond. Go to your providers, get screened. Always check your breast. It takes 5 minutes in the shower while you're laying in bed. You're on the phone with your best friend or whatever. Just check. Early detection means best prevention. We've talked about it a few times. Report any changes to your general provider. Always get it checked out. Even if you think it's insignificant, it only happened one time, get it checked out. Be breast aware. That's my favorite. So again, early detection saves lives. Mammograms will remain the best screening tool right now. Know your normal breast changes. Symptoms can appear in many different ways. And when in doubt, get checked. And I will say that for the rest of this year. When in doubt, get checked out. That's all I have. It was pretty quick. So if there are any questions.
I don't see
Well,
coming through.
thank you for listening to me tonight. And have a good night.
How else can people learn more about breast awareness?
Breast awareness. Right now, I'm working with the foundation, the Medical Foundation here with Summit Pacific, to hopefully beef up our breast awareness, breast cancer awareness, and breast health awareness. My goal is to get Summit Pacific dripping in information for women who are even coming in just for maybe their labs. We're always available, obviously, to answer questions if you're scared about your mammograms, if you're concerned about the mammogram, to walk you through it. So I think this year we're really putting in a big goal to make breast health a forefront in this, I want to say this county. This county is in desperate need of it. All right, thank you.